My husband, John, was a New York City firefighter. He was diagnosed with cancer in 2006, directly related to the World Trade Center, and he died from that cancer in 2009.
In 2008, I was diagnosed with stage 4 renal cancer, which had spread to my bones.
I have sarcoidosis with cardiac impact.
I developed COPD, including emphysema, asthma, bronchitis.
Sinusitis, GERD, COPD, and cancer.
I'm asthmatic. I've lost 25% of my lung capacity. I've got nodules in my lungs. And all these things I didn't have prior to 9/11.
So between the post-traumatic stress, the heart, the lungs, I'm a walking dead man, basically.
We had a track record of following people over a long time in their careers with the fire department, and we were able to see a sudden development of problems that we had not seen before.
Some of these presentations were unusual in a group for their age and for their level of fitness prior to their exposure.
He had an autoimmune disease called polymyositis. 3 in hundreds of thousands that would have a percentage of getting this disease. And we know 5 firemen that have it.
We see a lot of younger members with blood cancers like lymphomas and leukemias and multiple myeloma, which really I don't think would be expected in someone in that age population.
Some of these cancers aren't diagnosed yet that are going to come out, and we have to include them. We can't let those people fall through the cracks.
No way was I going to be allowed to die on a fire line. So I was retired. I was put out.
I made a deal with the doctor that I would do whatever they told me if I could stay on the job and return to full duty.
That was your last fire. He says, you're not going back to the firehouse. And after 32 years on the job, that came as kind of a shock because I was still having fun.
The police department determined that I was no longer fit to be a detective due to my illnesses, so they forced me into retirement.
If they take away our health care, a lot of guys are going to die real quick.
There's a lot of people out there that really need this, construction workers and EMS, that really need this bill to survive day to day.
They put themselves in harm's way to help others. And now, it is several years later. You can't abandon or forget about those people just because it's convenient to say, we've done enough.
It should be there for all of us who did what had to be done.
When the bill passed, it was a peace of mind, knowing that we were going to be covered for all the illnesses suffered down at Ground Zero, that our medications would be taken care of, and it would not be a financial burden on our families.
You want them to live as great a life as they can with their illness. If you start worrying about if you're going to lose your house, what's going to happen to this and what's going to happen to this, I think the reason that they can stay so positive is that they don't have those worries right now.
They are our neighbors, they are our families, they are the people who we hold up to others as an example of when your country needs you, who will step forward and help.
People are sick in all 50 states because they all came here to help volunteer their services.
They took care of this city, and they took care of this country, and they came down here and they did the right thing.
Please continue the funding. We need it.
We were your warriors that day. We need help.
You are the ones now who are supposed to protect us. And I'd like to believe that's what you're going to do.
Without this program, thousands upon thousands of people will be devastated financially, emotionally, and physically, and mentally. They need the support of Congress to continue this. They gave their lives to take care of other people, and they deserve to be treated for as long as they live.